everything that's in every pouch. And if it has an expiration date, I keep track of it. And then I can go on my sheet and I can say, okay, July of this year, I need to replace these items or, you know, for whatever reason.
He has that in Excel. I have to talk to him.
Yeah, I have a Excel program that I use to keep track of all this stuff. Need to suture somebody while we're here?
Yeah.
That's
Is that
the,
do it
Minor
yourself?
laceration kit. Tweezers, needle holder, I presume suture.
yeah. I've got the sutures in this bag here, but I keep an embu.
Oh, this is important. By the way, our next session, probably this summer, will be on CPR, cardiorespiratory, to include how to read an EKG and save somebody's life. So if I have a heart attack now, you've got 4 minutes to save my life. And you probably give me another 2 years to live. If you say I'll get hysterical, run out of the room, or do whatever, the patient's dead. So this is what you call an ambu bag. For those people that don't like to put their lips on somebody else, now you have, I think McKinley has some. It goes in the mouth, okay? And then you've got a tube for your mouth, so you don't have to touch skins and so on. So, and then the next step above that is what we call an ambu bag. You connect it to a mouth mask and you pump it, okay? So, if you're at this level in the medium and the ambulance people, they'll be trained in what we call putting stuff in the mouth and in the trachea.
Oh,
It's gonna go right in the trachea. So with an ambu bag, then you can pump the air right into the lungs. As compared with you trying to do it through the nose and the mouth, very little air is gonna go in the lungs. Okay, but the best you can do. So it's the same thing of raising the oxygen level from, let's say, 70% up to 99%. Most of our oxygen levels right now are around 98, 99%. And from the standpoint of, at that point, we'll get in there. Most of these devices now, blood pressure devices, pulse meters, oxygen meters, they're all electric. You put it on your finger, it takes your pulse, wrap this thing around your wrist, it'll take your blood pressure. And now we've got EKG machines that people have at home. Put your fingers on it, put it in your hand, and it reads an EKG, and you can send that by internet to your doctor.
So they're working on that. And they
Those are split?
and water and sewer is gonna call me back.
No, this
Well,
one needs to
this is-
be,
That's interesting. This has kind of gone out of style.
It's all right, sir. I thank you.
In
for
the old
everything
days,
that
it was
you
not
have
uncommon, just like in snake bites. When I grew up, if you got burnt bad, you put butter on it.
Yeah.
Worst thing in the world,
Yeah.
but that's what they did.
Burns like
Hundreds of
heck.
people were treated with butter. I was treated many times with butter. Prior to CPR, they would go in here with a pocket knife and stick a ballpoint pen in, a tube,
Empty, the empty one.
and give you air there. So that's what this is. This is a kit to cut the cricoid here and put in a tube. Again, the air going in here obviously is going to go to the lungs a lot quicker than this. So again, that's kind of out of, now we're training more and more people to do things such as ambu bags and so on. So,
Isn't that supposed
there
to
comes
change?
occasion where you don't have the, there comes a time when you just don't have the equipment or
Yep.
the time, and a person's suffocating to death,
You gotta do it.
you gotta do it the old-fashioned way.
Yep.
Okay, now here's the real world. Think about it. Okay. All of Italy,
All of it.
one country, yesterday
Red
was
zone.
quarantined.
Yep.
All of Italy.
That.
So it's coming here. It's just a matter of how much it's coming. 30 million people in China were quarantined at the start of this. I don't know where we're at now. But if you look at some of the things, they are taking people yelling and screaming out of their houses
Yeah.
and putting them in hospitals. So it's here.
Italy now has more
It's
deaths.
real. It's not
than
a,
China or-
Belton published yesterday their three-dimensional approach to quarantining for Belton Independent School District. Iran is quarantined. I'm saying, it just as easily can be us. If we goof up, really goof, Killeen will be quarantined, which means you won't leave your house for 14 days, minimum.
State's already set up 5 shelters.
Pardon?
The state has set up 5 shelters that I know of as of this morning in Texas.
He's saying it's part of our emergency.
Quarantine shelter.
As of this morning, he's saying that the shelters, what kind of shelters are they?
Quarantine shelters,
Quarantine.
medical shelters, I mean, they're
I just
staffed.
saw a lot of negative comments on the cruise ship off of California. Okay, they brought the positive tested patients, not the symptomatic ones, the positive tested patients who were not symptomatic, 100 plus, are at Lackland Air Force Base. Okay, they were upset there in Texas, but they forgot that that's what Lackland is for, that's what Brooke Army Hospital is for. That's what they're setting in San Antonio for. So I don't know what Darnell is doing, if they're getting anywhere near ready for it or not, but the emergency people are. FEMA is, right on down the line.
There's a website, I'm trying to think what it is, but it's run by the hospital Ship Hope that tracks it and gives an hourly report on internet. I'll try to send it to you. It's from
Yeah, there may come down, the governor may say to Texas, just like
Italy.
the country leader did to Italy. If we have a few cases pop up here and here, and it's growing, he may say all of Texas just shut down. So the question is, will you have enough water in your house?
The water shouldn't
Beverly, how
stop.
much should they have?
Water shouldn't stop though, right?
The minimum, 72 hours of everything,
Yeah.
minimum,
We have a year of everything.
huh?
Yeah.
A year.
Good. I've got a whole Baptist
Year of water?
so I can tell you.
A year of water?
That's
Oh
what
yeah,
our
we
church
collect
teaches
water
us.
off the our roof
Wow.
and collect it in a big rainwater storage. We can go like 3 months without rain.
And I drink lots of milk.
We
So
have
I
a
haven't drank
a well.
dry milk since I spent 2 years in Korea. I now have Nestle dry milk at home.
For treating burns, this one here in
Yeah.
the red handle is
Ross, any other
sutures
comments?
and injectables.
I took up too much time.
Pardon?
I took up too much time. You're cooking.
Okay, anyway, we've got our 2 hams here, so I wanted to,
Whoops, pick it
radio
up.
license, McKinley, Clark, if you have any questions, ask them.